American cardiologist Dr. HelenTaussig was one of the most celebrated physicians of the 20th century. Through her innovative work on blue baby syndrome, she founded the field of pediatric cardiology in the 1940s. Dr. Taussig was born in Cambridge, Massachusetts in 1898 to Frank W. Taussig, a prominent economist and professor at Harvard University, and Edith Guild. Despite battling dyslexia as a child and a bout with whooping cough that would leave her with significant hearing loss, she excelled in school and earned a degree from the University of California at Berkeley in 1921. She later studied at Harvard Medical School and Boston University. It was at Johns Hopkins that she developed her interest in cardiac research. Upon graduation from Hopkins in 1927, Dr. Taussig had lost her hearing and relied on lip reading and hearing aids for the remainder of her career. In 1930, she became the head of Johns Hopkins Children's Heart Clinic, where she remained until she retired in 1963. Some of her innovations in pediatric cardiology have been attributed to her ability to distinguish the rhythms of normal and damaged hearts by touch rather than by sound. In 1941, she developed a surgical procedure to correct blue baby syndrome. Anoxemia, or blue baby syndrome, is a congenital heart condition caused by a defect that prevents the heart from receiving enough oxygen. Dr. Taussig used fluoroscopy, a new X-ray technique, to prove that babies with anoxemia had a leaking septum, the wall that separates the chambers of the heart, and an underdeveloped artery leading from the heart to the lungs. On November 9, 1944, Dr. Taussig and Dr. Alfred Blaylock became the first to perform the new operation on a child with anoxemia. Together, they published their results in the Journal of the American Medical Association. The technique was named the Blaylock-Taussig operation and was soon used worldwide. In addition to repairing babies' hearts, the Blaylock-Taussig procedure was also a forerunner to adult open-heart surgery. Taussig published an important piece of medical literature, Congenital Malformations of the Heart, in 1947. For her contributions to the field of pediatric cardiology, Dr. Taussig was awarded a number of honors, including the Albert Lasker Award, the Presidential Medal of Freedom by Lyndon Johnson, a Chevalier in the French Legion of Honor, and the honor of being one of the first women to be awarded a full professorship at Johns Hopkins. She became the first female president of the American Heart Association in 1965. Dr. Taussig continued to perform research and remained active until her death in 1986. Her incredible career as a pioneering doctor of pediatric cardiology helped save the lives of thousands of children and also helped pave the way for other female doctors to practice medicine. Standing on the shoulders of Dr. Taussig is 2013 Pizan Living Legacy Award winner, Dr. Etta Pisano, who has also been a pioneer and innovator in the medical field. Dr. Pisano is the Vice President for Medical Affairs and Dean of the College of Medicine at the Medical University of South Carolina. She is a leader in breast cancer imaging. Dr. Pisano was born in New York City and was raised in the suburbs of Philadelphia. She received her undergraduate degree in philosophy from Dartmouth College and her medical degree from Duke University. Pisano completed her radiology residency at Beth Israel Hospital of Harvard Medical School, followed by a year as Chief of Breast Imaging and instruction in radiology at the same institution. Prior to accepting the position at MUSC, Dr. Pisano served as Vice Dean for Academic Affairs at the University of North Carolina School of Medicine, Keenan Professor of Radiology and Biomedical Engineering, Director of the UNC Biomedical Research Imaging Center, and Director of the North Carolina Translational and Clinical Sciences Institute. Dr. Pisano's professional interests center around the development, application, and testing of imaging technology for the early detection and diagnosis of breast cancer and other breast problems. She is a past president of the Association of University Radiologists and the American Association for Women Radiologists, and has been named by Diagnostic Imaging magazine as one of the 20 most influential people in radiology. In 2003, she was appointed as the first director of the UNC Biomedical Research Imaging Center, where she successfully raised over $20 million from private donors, industry, and the university to support its activities. Dr. Pisano served as the principal investigator of the largest clinical trial ever run by a radiologist, the Digital Mammographic Imaging Screening Trial, which enrolled nearly 50,000 women in a study comparing digital to film mammography, the results of which were published in 2005 in the New England Journal of Medicine. She is the recipient of many honors, including the Ladies' Home Journal Health Breakthrough Award and a membership in the Institute of Medicine of the National Academy of Sciences. Dr. Pizan recently co-founded her own company, Next-Ray Inc., which will commercialize a device she and her fellow co-founders invented, a technology which creates medical images using X-rays through diffraction-enhanced imaging, which provides superior image quality at a dose that is substantially lower than is currently available. This will be most important to children and young adults and young women undergoing breast cancer screening. Like Dr. HelenTaussig before her, Dr. Pizan's medical work has been groundbreaking in the lives of children and women and has helped save the lives of many people. She has paved the way for other women to follow into the field of medicine.